How do you know if you have a sprain or a strain for rice treatment? Imagine twisting your ankle during a game or feeling a sudden muscle ache after lifting weights. How do you tell if it's a sprain or a strain? Knowing the difference helps you treat it right away. A sprain happens when the ligaments, which are tough bands of tissue connecting bones at a joint, get overstretched or torn. This usually happens from twisting or forcing a joint beyond its normal movement. For example, rolling your ankle during a run can cause a sprain. Symptoms include pain, swelling, bruising around the joint, and sometimes a popping sound at the moment of injury. You might also feel the joint is unstable, or it might give way when you try to stand or walk. A strain affects muscles or tendons, which are cords connecting muscles to bones. Strains often occur from overstretching or tearing these soft tissues, like when you suddenly lift a heavy object or overstress a muscle during exercise. Common areas for strains include the hamstrings, calves, or lower back. Symptoms include muscle soreness, spasms, or cramping, and pain around the affected muscle. Swelling can happen, but bruising is less common than with sprains. You might notice limited flexibility or difficulty moving the muscle normally. Both injuries share symptoms like pain, swelling, stiffness, and reduced movement, so it can be tricky to tell them apart just by feeling. However, bruising and joint instability usually point to a sprain. If you feel muscle spasms and soreness without bruising, it's more likely a strain. Applying the Rice method, rest, ice, compression, and elevation, is a good first step for either injury. Rest helps prevent further damage, ice reduces inflammation and pain, compression supports the area, and elevation helps decrease swelling. Using Rice early can speed up recovery and help you stay active in school and sports. Knowing whether you have a sprain or a strain is important because it guides your treatment. If symptoms are severe, don't improve after a few days, or if you notice intense pain or joint instability, it's best to see a healthcare professional. They can do a proper exam and possibly imaging tests to confirm the injury. If you experience pain and swelling after a twist or fall, and the joint feels unstable or you hear a pop, you probably have a sprain. If you feel muscle pain, spasms, or cramping after overuse or sudden movement, it's likely a strain. Applying Rice quickly helps manage both injuries, reduce pain, and get you back to your activities faster. Remember, taking care of injuries early keeps you balanced between sports and school without missing out on either.